Starting tonight's Medical Watch, a patient who refused to ignore her instincts, even as her doctor tried to convince her she was healthy. She's sharing her experience, speaking out to help save others. This cancer survivor's message: always trust your gut. Deep breath. Carrie King can breathe a little easier knowing she's now in the right hands, but getting here took time.
It was nothing more than me listening to that voice inside my head that tells you something's not right here.
Something wasn't right. Carrie's first symptom, urinary frequency. That was 5 years ago. Then blood in her urine. Her primary care physician's reaction?
He was completely not worried about it.
It's a story Dr. Steinberg hears all too often.
There's no question in my mind that there's a significant delay in diagnosis.
Last year when I went in for my annual physical, was the 5th year, and I'm hearing the same thing. And a couple weeks after my appointment, I emailed my doctor and said, you know, since I've had these 2 symptoms over time, don't you think we should check it out?
A visit to the urologist confirmed Carrie's fears. She had bladder cancer. But there was hope. They caught it just in time.
If we had waited another year, it would have been too far gone for them to help me. The really scary thing was the primary care physician said, we'll check again in a year. Every time I think of that, it just scares me to pieces.
Absolutely, positively, no question in my mind that we need to do a better job educating the public. We need to do a better job of educating primary care physicians and obstetricians and gynecologists, as well as internists, as to the importance of blood in the urine.
It's a simple question, an even simpler test. Is there bacteria present indicating an infection, or is it something else?
It's critically important that patients and their physicians realize that if there's blood in the urine, you must rule out bladder cancer.
Carrie's persistence paid off, but not without pain. When infusions of medication didn't kill all the cancerous cells, she opted for surgery. Dr. Steinberg removed Carrie's natural bladder and replaced it with a neobladder made from a portion of her small intestine.
I feel great. In fact, I'm at the point 3 months out from surgery where I'm starting to forget that this huge medical ordeal ever happened.
But she doesn't want others to forget the lesson she's learned.
And it was such a wake-up call for me. It was such an epic wake-up call that I feel obligated to let other people know that if you have symptoms, in my case, classic symptoms, don't ignore those. No one's going to be a bigger advocate for your health than you are.
Bladder cancer is more common among men than women. There are 70,000 new cases diagnosed annually, with up to 15,000 people dying from the disease in the U.S. each year. We've posted more information about bladder cancer on our website, WGNTV.com.
Thank you, Dina. Still